injection, and this is your first dose. Alright, so then I want to explain something to you before the injection. Alright, so tetanus injection, it protects you from getting tetanus. Alright, so somebody will ask, why do we get tetanus? So this, our environment is not sterile. Why am I saying it's not sterile? Because the environment is made up of bacteria and microbes. And what causes tetanus is a bacteria known as Clostridium tetani. And when you get the tetanus, these are some of the signs and symptoms of tetanus. 1, there will be lockjaw. 2, you see that you have muscle spasm in your stomach, in your tummy. Your body becomes so painful, the muscles are so stiff, become so painful, you can't swallow, you can't breathe well, so you have problem with even breathing and all these things. Also, with tetanus injection, when I give you the injection, what it does is that you build up antibacteria. And when I say antibacteria, it is like you are building up soldiers to fight against the tetanus or to fight against the infection. And we can get tetanus through what? Through cats. When there's cats in your body, so if you're the pregnant woman, you are so prone to tetanus. That is why we always tell you that come for the tetanus injection when you are not pregnant. But when you are pregnant, it is very, very important for you to come for it. Why? Because you sustain some injury, either directly or indirectly. When the baby is coming, sometimes the perineal area where the baby is passing, you can get some cracks there, and you know that through cuts you can get what? Infection, you can get a tetanus. Are we okay? Also, maybe you go to the CS, the doctor will give you a cut. So with a pregnant woman, you are prone to tetanus. So I'm going to teach you the schedules of the tetanus injection so that you don't miss it. So when I have met you today, so let's look at our book. That is the antenatal book, page 8. So this is how the book looks like. So tetanus injection, the first dose. When I give you the first dose, it doesn't have any protection, only 4 weeks. So after 4 weeks, you need to come for the second injection. From the second injection, the third injection is 6 months from the second injection. And then the third injection, you take the fourth injection 1 year after the third injection. And then the fourth injection to 1 year after the fourth injection. So when you are able to take up to the fifth injection, you are protected to what? Up to your reproductive age, which means that from your time of what? Menses to what? To your menopause age. So I'm going to take the schedule again. When I give you tetanus 1, that one has only 4 weeks of protection. So when you come after 4 weeks, I have to start again, which you know is a little bit painful. And when I finish, I'll talk to you about how painful and what you have to do. Are we okay? So with the TT1, when you take it, it has only 4 weeks protection. TT2 has up to from 6 months to how many months? To 3 years of protection. But as the earlier you take it, the better. So the tetanus 2 is 6 months to 3 years of protection. Tetanus 3 is 5 years of protection. Tetanus 4 is 10 years of protection. And tetanus 5 is 45 years, which is the reproductive years. So you can give birth to all your children without getting tetanus. Also, when we give you the tetanus, we give it to you at your left upper arm. And when we give it to you, I tell my patients that they should be exercising their hand so they don't feel the 3 days pain. And most of them have come to tell me that it actually works. But one thing is that nobody has ever complained of tetanus abscess. I don't know about your place, but in case that maybe somebody tells you about tetanus abscess, just don't worry, come to the hospital, we will sort you out. Thank you. Please, do you have any question for me?
No.
Thank you so much. So let me give you the injection.